How the heart works. The heart is a muscle organ about the size of your fist, and it has 4 chambers or sections. Each side of the heart has an upper chamber, called atrium, and lower chamber, called ventricle. The 4 chambers contract in rhythm to pump blood efficiently to the lungs and the rest of the body. The right side of the heart pumps the unoxygenated or oxygen-poor blood, shown in blue, through the pulmonary artery to the lungs to pick up oxygen. The oxygenated or oxygen-rich blood, shown in red, returns to the left side of the heart and is pumped out to different parts of the body through the large artery called aorta. Blood vessels called veins bring blood to the heart, while other blood vessels called arteries carry blood away from the heart. What is congestive heart failure? Congestive heart failure, or heart failure, is a condition that weakens the ability of the heart to fill with blood or pump enough blood to the rest of the body. It develops over time as the pumping action of the heart becomes weaker. It can affect the left side, the right side, or both sides of the heart. There is backup of blood and fluid, which may build up in the feet, ankles, legs, arms, liver, lungs, or other organs. The heart becomes larger and pumps faster. Blood vessels become narrower. Organ failure occurs. These conditions are life-threatening. Risk factors for congestive heart failure: coronary artery disease, heart attack, high blood pressure, diabetes, obesity, abnormal heart valves, abnormal heartbeats, heart defects you were born with, viral infection, alcohol or drug abuse, smoking. Symptoms of congestive heart failure: shortness of breath, coughing, or wheezing, swelling in the feet, ankles, legs, and sometimes abdomen, sudden weight gain, feeling tired and weak, dizziness and confusion, nausea and loss of appetite, rapid or irregular heartbeat. Diagnosis of congestive heart failure: your doctor will take a careful medical history and perform a physical exam. Your doctor may also order some of these tests: chest X-ray, blood tests, electrocardiogram, EKG, echocardiogram, stress test, cardiac CT scan or MRI, angiogram. Treatment of congestive heart failure. Congestive heart failure is a serious chronic condition that has no cure, but can be managed by lifestyle changes, medications, and regular medical visits. The goal of treatment is to treat the underlying cause of heart failure. Treatment includes lifestyle changes. Follow a heart-healthy low-salt, sodium, low-saturated fat, trans fat, and cholesterol diet. Drink proper amount of fluid. Get regular exercise. Talk to your doctor first before beginning any exercise program. Maintain a healthy weight if overweight or obese. Control high blood pressure, high cholesterol, and diabetes. Stop smoking. Limit alcohol. Reduce stress. Get enough rest. Heart-healthy diet. Limit sodium intake to less than 1,500 milligrams a day. 1 teaspoon of salt contains 2,196 milligrams of sodium. 1 teaspoon of chicken-flavored powder contains 900 milligrams of sodium. 1 teaspoon of MSG contains 687 milligrams of sodium. 1 teaspoon of soy sauce contains 440 milligrams of sodium. 1 teaspoon of oyster sauce contains 225 milligrams of sodium. Cook foods with herbs, spices, lemon, lime, vinegar, garlic, ginger, onion, or salt-free seasoning blends. Avoid adding salt, soy sauce, oyster sauce, processed, preserved, pickled, smoked, and canned foods. Limit baked goods, convenience foods, Asian seasonings and sauces. Read food labels to choose products lower in sodium. Limit saturated fat, trans fat, and cholesterol. Choose low-fat protein foods such as lean meats, seafood, chicken breast, tofu, and egg white. Remove all visible fat and skin from meat. Choose fat-free or low-fat dairy products. Reduce high cholesterol foods such as organ meats, liver, gizzard, kidney, brain, tongue, egg yolk, shrimp, cuttlefish, and squid. Reduce animal fats, lard, chicken fat, butter, fried foods, dim sum, margarine, mayonnaise, and salad dressing. Avoid coconut milk. Limit baked goods, fast foods, and processed foods. Increase fiber. Eat more oats, barley, brown rice, dried beans and peas, whole grain breads and cereals, fresh fruits, and vegetables. Medication do's and don'ts. Medication do's. Make a list of the medications that you are taking and be sure you know why you are taking them. Bring the list or all your medication bottles to every doctor's visit. Follow instructions on the prescription label so you know how much, how often, and when to take your medicine, as well as what foods, beverages, other drugs, or activities to avoid, if any. Know what the side effects might be and what you should do if you experience any. Keep your prescription in its original bottle and label it clearly so you know what it's for. Obtain a refill at least 3 days before you run out of medicine. Keep prescriptions away from children, and if there are children around the house, use child-proof bottles. Store prescriptions in a cool and dry place. Throw away prescriptions that have expired. If you take any over-the-counter medications, herbal supplements, or Chinese herbal medicine regularly, let your doctor or pharmacist know. Medication don'ts. Don't drink alcohol when taking medication. Don't change the amount of medication you take. Don't ever take someone else's medication. Don't skip or stop taking your medicine. Don't try to catch up by doubling the next dose. Don't take less medicine than prescribed, even if you feel fine. Don't share medicine with friends or family members. Medicine works differently for different people. Don't take expired medications. Heart medications mentioned in this video are subject to change without notice. For the latest information on heart medications, talk to your doctor or pharmacist. Heart medications. They help to improve the heart's ability to pump blood, open blood vessels to improve blood flow, slow down heart rate, reduce blood pressure, reduce stress on the heart, reduce buildup of fluid. Angiotensin-converting enzyme, ACE inhibitors. These medications relax blood vessels to lower blood pressure. Possible side effects include dry cough, dizziness, headache. Commonly prescribed medications in this class are benazepril, enalapril, lisinopril, brand name, Lotensin, Vasotec, Zestril. angiotensin II receptor blockers, ARBs. These medications widen blood vessels to reduce blood pressure. Possible side effects include dizziness, headache, diarrhea, fatigue. Commonly prescribed medications in this class are losartan, telmisartan, valsartan, brand name, Cozar, Micardis, Diovan. Beta blockers. These medications slow down heart rate to lower blood pressure. Possible side effects include dizziness, cold hands and feet, fatigue, diarrhea. Commonly prescribed medications in this class are atenolol, metoprolol, carvedilol, brand name, Tenormin, Lopressor, Toprol XL, Coreg. Calcium channel blockers. These medications relax blood vessels to lower blood pressure and improve blood flow. Possible side effects include dizziness, headaches, ankle swelling. Commonly prescribed medications in this class are amlodipine, deltiazem, verapamil, nifedipine, brand name, Norvasc, Cardizem, Calin, Procardia. Diuretics or water pills. These medications remove excess fluids and sodium from the body to reduce blood pressure. Possible side effects include dizziness, leg cramps, gout, a type of arthritis. Commonly prescribed medications in this class are furosemide, spironolactone, hydrochlorothiazide, indapamide, brand name, Lasix, aldactone, hydrodiaryl, Lozol. Digitalis. These medications strengthen heart contractions. Possible side effects include nausea, diarrhea. Commonly prescribed medication in this class is digoxin, brand name, Lanoxin. Vasodilators. These medications relax blood vessels and increase blood flow to the heart. Possible side effects include lightheadedness, headaches. Commonly prescribed medications in this class are nitroglycerin, isosorbide dinitrate, hydralazine, brand name, Nitrostat, Isordil, Aprezoline. Lipid-lowering medications. These medications reduce LDL, bad cholesterol, reduce triglyceride, raise HDL, good cholesterol. Possible side effects include upset stomach, nausea, muscle pain, fatigue, poor sleep. Commonly prescribed medications in this class are statins, fenofibrate, gemfibrozil, ezetimibe, brand name, Lipitor, Zocor, Pravachol, Mevacor, Tricor, Lopid, Zetia. Anti-clotting medications or blood thinners. These medications prevent clots from forming in the blood. Possible side effects include stomach irritation, bruising, bleeding. Commonly prescribed medications in this class are aspirin, clopidogrel, warfarin, dabigatran, brand name, Bayer aspirin, Plavix, Coumadin, Pradaxa. Oxygen therapy. For persons with severe heart failure, long-term supplemental oxygen may be prescribed. Surgery. For persons with severe heart failure, surgery may be recommended. Daily activities and rest. Do daily exercises as recommended by your doctor. Pace daily activities with rest periods. Breathe evenly in a smooth, relaxed manner at all times. Sleep with your head propped up using pillows. Avoid large meals before bedtime. Avoid lifting, stair climbing, walking uphill. Monitoring symptoms at home. Check your weight daily and keep a record. Call the doctor if you notice an unusual weight gain of 2 pounds a day or 3 pounds a week. Check for signs of swelling in the feet, ankles, legs, or abdomen. Record how much you drink and urinate. Keep track of symptoms. Example, shortness of breath, coughing, leg swelling, fatigue, and notify doctor if new symptoms appear or if symptoms worsen. When to call the doctor. Call your doctor when you experience the following: unexplained weight gain of 2 pounds a day or 3 pounds a week, swelling in the feet, ankles, legs, or abdomen that has worsened, shortness of breath that is worsening or occurring more often, especially during activity, a feeling of stomach fullness with poor appetite or nausea, extreme fatigue or inability to complete daily activities, a respiratory infection or cough that has worsened, fast heart rate, 120 beats per minute, or new irregular heartbeat, confusion, chest pain or discomfort. When to seek emergency treatment or call 911. Go to the nearest emergency room or call 911 if you experience chest pain or discomfort that is severe, unexpected, and occurs with shortness of breath, sweating, nausea, or weakness. Fast heart rate, 120 to 150 beats per minute, with shortness of breath. Shortness of breath not relieved by rest. Sudden onset of severe headache. Fainting spell with loss of consciousness.